If you are a woman watching this right now, then there is an 80% chance you have something which is damaging your body and causing you to feel tired, have hair fall or hair thinning issues. It is causing brain fog issues. Plus, it also leads to mood changes and mood swings, and also is a major reason of thyroid and other hormonal problems. And here's a kicker, that most likely your doctor has not even tested you for it. And I'm not talking about a disease or a very rare condition. And this is very common in women of any age. And I'm talking about low ferritin. And before you click away thinking that it is only about low iron deficiency, then stay with me, because what I'm going to share with you is literally going to change your life. Hi, I'm Dr. Anshul Gupta, a former Cleveland Clinic functional medicine physician from US. I help people improve their chronic diseases by making personalized functional medicine plans. Are you exhausted by 2 p.m.? Do you have hair fall or hair thinning issues? Are you losing your mental focus or have brain fog? Do you feel anxious, stressed out, or do you have hormonal issues, specifically thyroid? You guessed it right, it is low ferritin. So let me first tell you what exactly is this ferritin and why such a common condition which is present in majority of the women is not being addressed. So ferritin is the molecule in the body which stores your iron. And you know that iron is very important to make hemoglobin in the body, which carries oxygen across all of your body. Now you might say over here, my doctor already checked my hemoglobin levels and they were perfectly normal. Well, that's where the problem starts. By the time the blood work results will show that your hemoglobin is low, your ferritin levels have been low for a very long time. That means your iron and ferritin stores have been running low for a very long time and you had no idea about it because your doctor never checked for it. Even just checking your iron levels is not enough because you need those ferritin stores in your body to have adequate and long-term supply of iron all the time in your body. Another problem with the lab test is that when you get your ferritin level tested, it has a very wide range in the labs. It goes anywhere from 30 to 200. Most of the women are in the lower end of ferritin between 30 to 50. And research studies suggest that that is not the optimal level of ferritin that you need to function at your peak performance. And that is why there are some estimates that 8 in 10 women have suboptimal ferritin levels, and that's the reason women are more prone to getting chronic diseases as well as have more severe symptoms. So the next question is that why women are more prone to low ferritin as compared to men. So let me share the reasons, and then after that I'm going to share with you the lab test to get for it and how to read those lab tests to get your levels to the optimal level. And in the end, I'm going to share with you how you can naturally raise your ferritin levels. The first reason is very obvious, that is the menstrual periods. Every month when you are having those menstrual periods, you are losing a lot of blood and you lose a lot of iron during that time. Approximately you are losing 1 to 2 milligrams of iron per day of those menstrual periods. So just imagine months after months, your body does get deficient into that iron, which affects your ferritin stores. The second reason is that women have naturally low stores of iron as compared to men. Even in the lab tests, the ranges of ferritin for women and men are different. So that's the reason naturally women's body have low ferritin, which makes them even prone to having low iron stores in their body. The third reason is the diet. On an average, women consume less amount of animal and meat products. And these meat products have heme containing compounds which raises your iron. So if you are a vegan or vegetarian, or even you are a non-vegetarian but not eating enough animal products, you are at risk for low iron and low ferritin issues. So these are all the reasons that women are more prone to low iron and low ferritin levels. Now let me also share quickly with you all the symptoms which are associated with low ferritin so you are aware of it. The very first symptom is that you get tired very easily. Even after minimal work or in the afternoon around 2 to 4 p.m. if you feel that your energy is getting low, then that is because of low ferritin. If you have noticed recently that your hair is thinning or you are losing more hair than usual, that is because of low ferritin, because iron is needed for proper hair health. If you do suffer from hormonal issues like PCOS or you have thyroid issues, that can also be because low iron and ferritin, because again iron is needed to support all of your hormones in your body. If you feel anxious or get stressed out very easily, that is again another sign. If you feel dizziness or shortness of breath very easily, that is another sign of low iron. And if you have weakened immune system, that you get sick or common colds very easily or sinus infections very easily, that is again a sign of low iron or low ferritin. So these are all the symptoms. Now let's talk about the testing, how you can know your ferritin levels. So the very first thing is that whenever you get your blood work done, majority of the time you are only getting a CBC, which is only checking your hemoglobin levels. And as I told you before, hemoglobin is not telling you the complete picture. So you need to get a complete iron profile, which includes iron levels, ferritin levels, as well as you need to get TIBC, which is total iron binding capacity, also checked. Now, as I shared with you, different labs will have different ranges, but most of the ranges are very wide. They go from anywhere from 30 to 200, and that is a very wide range. For optimal functioning of your body, you need your ferritin levels at least more than 50. So optimal levels are between 50 to 70. Now, as a caution over here, we do not want too much ferritin either, because you can get toxic on iron too. So if your ferritin levels are going beyond hundreds, so that is a time to cut back on your iron supplementation. So you're feeling all of these symptoms and plus your ferritin is suboptimal. What is the best way of increasing it? So the best way of increasing it is by taking an iron supplement. Now here's the problem. Most of the iron supplement which is available over the counter is ferrous sulfate or ferrous carbonate. Those are useless. They actually give you constipation and irritate your gut, and they are not very well absorbed. So the best form of iron that is absorbed is ferrous glycinate or ferrous bisglycinate, and that will not give you stomach upset. And the typical dosage is between 25 to 65 milligrams on the daily basis. Now a couple of other tips over here. Do not take your iron supplementation with tea, coffee or calcium supplements because it interferes with its absorption. The best way to take iron supplementation is to take with vitamin C containing fruits, like either a vitamin C supplement or either add lemon or lime to a glass of water and take that with your iron supplement. And again, your iron or your ferritin stores are not going to get better in a day or two. You need a minimum of 3 to 4 months of taking these supplementations so that you will notice a difference in how you're feeling, plus for your levels to increase high also. Along with taking the supplementation, I'm also a big fan of optimizing your diet. So make sure you are including iron rich foods on the regular basis too. The highest source of iron containing foods are red meats, oysters, sardines. For people who are vegan or vegetarian, they can eat spinach and other green leafy vegetables. Lentils and legumes also have some iron in them. Plus pumpkin seeds are also good source of iron. And again, whenever you are eating iron containing foods, try to have some vitamin C with it, which can be easily a lemon or lime that enhances the absorption of iron in your body. So today I shared with you a very common problem with lot of females are going through, and that leads to having several symptoms as well as several diseases that they might be going through. But unfortunately, you are unaware of your ferritin levels. So it is very important to make yourself aware of optimal iron and optimal ferritin levels so that you can take your health under control and start improving your iron and ferritin levels, so that way you can feel better again. Trust me, this has made a huge difference in several of my patients, and it is an easy fix, and that's the reason I wanted to share that with you. So I hope you like this video. If you do, please like and subscribe to my channel so you keep on getting this information in the future too. Plus share this information with others who can benefit from it. Until next time, take care. Bye-bye.